We are going to talk about a disease that has been on everyone's lips lately, which is found in almost everyone when an ultrasound is performed. Fatty liver disease. What is this fatty liver disease, and how do I treat fatty liver disease in 7 steps? We will talk about how to prevent it without medication. I bet that if you follow the 7 steps in this video, there will be no trace of fatty liver. In fact, fatty liver disease is an umbrella term for us. We mean a general diagnosis that brings together many causes. In medicine, fatty liver disease is divided into 2 types: non-alcoholic fatty liver disease, non-alcoholic fatty liver disease, and alcoholic fatty liver disease. In the US, for example, the most common cause of cirrhosis is alcoholic fatty liver disease, while in Turkey, the most common cause of cirrhosis is non-alcoholic fatty liver disease. So fatty liver disease can indeed lead to cirrhosis. So is every person with fatty liver disease at risk for cirrhosis? This is absolutely not true. Fatty liver disease is a reversible condition. If it is reversed, the risk of cirrhosis will disappear. However, if inflammation occurs on the background of fatty liver disease, which we call hepatitis, we can see this in liver values and blood picture. If this inflammation occurs, it means that 10% of cirrhosis has started. So if fatty liver disease remains, if you treat it with lifestyle changes, you can completely avoid the risk of cirrhosis. However, if care is not taken, cirrhosis can occur at the end of the road. We classify fatty liver disease into 3 stages. Grade 1, Grade 2, and Grade 3 will really accelerate the progression to cirrhosis. If you have Grade 3 fatty liver disease, make sure you follow the 7 steps in this video. Step 1. Lose your excess weight. Just as our body gets fat, fatty liver is the enlargement of the liver when the liver gains weight. The most common cause of enlarged liver is fatty liver. If the body gets fat, the liver gets fat. The liver is the mirror of the body. If you consume too many carbohydrates in your diet, if your calorie intake is too high and you are sedentary, the liver will become fat. Therefore, we recommend reducing the fat around the waist in fatty liver disease. We even ask for a weight loss of 7 to 10% if possible. So if a person weighs 90 kilograms and has fat around the waist, at least a 10% weight loss is necessary. He needs to go from 90 kilograms to 81 kilograms. As you lose weight, the liver will lose fat and your liver will become lighter. Step 2. Mediterranean diet. The Mediterranean diet is one of the longest and most studied diets in history, with the most proven benefits. The Mediterranean diet is not a miracle diet, it is a rainbow diet. It is a diet that is predominantly plant-based, from dairy products to meat and eggs, but also includes animal foods. Even if you cannot lose weight with the Mediterranean diet, you can treat fatty liver disease. When you switch from a carbohydrate-heavy industrial diet to the Mediterranean diet, you can treat fatty liver disease even if you cannot lose weight. You can find the steps of the Mediterranean diet on my website. What you need to know is no processed foods and no sugar. Carbohydrates should be minimal. High carbohydrate consumption will cause fatty liver. Processed foods are toxic and increase the risk of fatty liver. Step 3. Drink coffee. Drinking coffee really reduces the risk of fatty liver. If I was stranded on an island and they offered me only 1 drink, I would choose coffee, because coffee consumption over 2 cups can slow the progression to cirrhosis in non-alcoholic fatty liver disease by 90%. This is a miracle figure. You can seriously prevent the progression to cirrhosis with coffee consumption alone. If you don't have any symptoms related to coffee, I generally recommend coffee consumption. But remember, it should be filter coffee, and it should be drunk at the right time and in the right way. Please don't forget to watch our video on coffee. Step 4. Be active, don't be sedentary. Get up from your seat, take long walks, do cardio exercises for 45 minutes 4 days a week. Do exercises that increase your heart rate and keep you alive. Swim, play tennis, shoot baskets, play soccer, lift weights, as long as you move. Inactivity is one of the most common causes of fatty liver disease. As you exercise and get moving, fatty liver disease will go away on its own. Even if you don't change your diet drastically, fatty liver will improve as you walk and do brisk exercise. If you want to do brisk exercise, I recommend that you first consult a cardiologist. Because if the risk factors are too high, you should consult your doctor to get approval to do brisk exercise. Step 5. Sugar. The most common cause of fatty liver disease in society is sugar, excess carbohydrate consumption, especially processed carbohydrates. A person with fatty liver disease should not continue to consume sweets. They should not consume bread and pasta. Especially bakery products, cakes, pastries, pies, donuts should not be consumed. You may see fatty liver disease as a fatty liver disease and you may blame fats, but carbohydrates are a much bigger culprit. If you consume beneficial fats, the liver will no longer have to produce fats and will use them. As you consume carbohydrates, the body will convert the excess calories into the form of triglycerides and storage around the liver. As you consume carbohydrates, the liver will become fatty. Useful fats reduce the risk of fatty liver. The more sweets and sugar you consume, the sicker you become. Fats such as butter and olive oil reduce the risk of fatty liver, but vegetable refined oils, for example sunflower oil, canola oil, and palm oils, which are omega-6 stores, are toxic fats. They are omega-6 and increase the risk of fatty liver disease, inflammation, and cirrhosis. If you have fatty liver disease, you can avoid serious fatty liver disease simply by changing the type of fat you use. Sugar? What the hell? A person with fatty liver disease should avoid sugar, reduce or even minimize bread consumption. They should not eat rice every day. They should not consume carbohydrates. Carbohydrate consumption should be less than 20% of total daily calories. If possible, even grain products should be reduced. Too much cereals will increase the risk of excess carbohydrates and fatty liver disease. Sugar and simple carbohydrates should be eliminated from your diet. Step 6. Manage your stress. Teacher, you say fatty liver disease, you say stress. What does it have to do with it? Stress means that cortisol rises after stress. Cortisol means that blood sugar rises in the body. Blood sugar means insulin. Elevated insulin means insulin resistance. It means metabolic syndrome. And one of the most common causes of fatty liver is stress. A stressful life causes emotional hunger attacks. Since the cortisol level in the body will remain constantly high, this blood sugar spike will cause rapid fat gain in the body and lead to junk food consumption. You need to manage your stress. You need to have good sleep patterns. By stress management, I don't mean that when stress comes, I will manage it. I am talking about taking additional arguments, grounding yourself, taking a forest bath, taking care of your sleep patterns, exercising, reading a book, taking a cold shower. Nobody can manage their stress out of the blue. Please watch our video on stress management. Learn how to manage stress in the best way in 10 steps. Step 7. Alcohol and smoking. Although it is not consumed frequently in our country, alcohol is the most common cause of fatty liver disease abroad. Alcohol consumption is one of the biggest causes of fatty liver disease. However, the relatively low alcohol consumption in our country causes the type of fatty liver disease to be different. Fatty liver due to alcohol consumption increases the risk of liver inflammation, which we call progressive hepatitis, much more. If fatty liver disease has developed due to nutritional lifestyle disorder, it will gradually progress to cirrhosis, stage 1, stage 2, and stage 3. However, if you have alcohol-related fatty liver disease, it can go directly to cirrhosis without following any of these stages. Especially if you have alcohol-related fatty liver disease, you should know that your risk of cirrhosis is much higher. The risk of cirrhosis is not to be underestimated. It means that the main cleansing organ of the body cannot function. Believe me, you don't want to get cirrhosis. If you have fatty liver disease and you have alcohol in your diet, we should not be discussing this anymore. Alcohol should no longer be in your diet and in your daily life. If you have a serious problem with it, if you have an addiction, you can get support. Do not say, I drink 2 glasses every day, I drink once a week. If you have fatty liver disease due to alcohol, you should eliminate alcohol and get support if possible. Smoking is another factor that increases the risk of fatty liver disease. Smoking means oxidation. It means the formation of free oxygen radicals in the body. This can lead to increased stress in the body, vascular damage, and fatty liver disease. By following the 7 steps in this video, you can completely prevent fatty liver disease and treat fatty liver disease if you have it. Remember this, there is no drug treatment for fatty liver disease. The biggest treatment for fatty liver is lifestyle change. We cannot say, Hoja, give a medicine and this will go away. For example, if a diabetic patient has fatty liver disease, the use of metformin may partially reduce this fatty liver disease. However, in normal individuals, if there is no sugar-related condition, if there is no hidden sugar, giving metformin will not change the situation much. All roads lead to diet, all roads lead to exercise. In fact, the recommendations in all of the videos are generally similar and generally lead to the same path for health. Please follow the 7 steps in this video and eliminate fatty liver disease. Goodbye.